Hello, welcome everyone, and thanks for joining us today. My name is Donna Rubenstein, and I'm here with Judy Porter to share our insights from a part of the PriCARE research program. Before jumping in, I will set the stage with a high-level snapshot of the project. It's a 3-year CIHR-funded study looking at case management for patients with multiple chronic conditions and complex needs. The focus is on implementation of case management to better understand the how and why of this model in different primary care settings, what researchers call barriers and facilitators. With the learnings, we also hope to identify next steps to support scaling across Canada. As a patient partner, this is critical to me. We must do better at scaling good ideas. It's essential to improving healthcare. The project includes 5 provinces with a project team in each province. There are 1 or 2 clinics participating in each province and 1 or 2 patient partners per province. Having a cross-Canada patient partner group gave us an incredibly diverse mix of experiences, backgrounds, and skills, which definitely added richness to our perspective. And of course, we must acknowledge COVID, the annoying bug that impacted everyone. We too had to alter plans and adapt. While it handicapped us in some aspects of the program, it also opened the door to some unplanned opportunities. So now onto our story today that looks at the human side of research, the power of listening and stepping out of our comfort zones, both untapped doors to enhancing the value and impact of research.
So the truth is that we can all look at one item and see it differently. We look through different perspectives. So it's one of the issues that we have to face when it comes to researchers and patient partners working together. Researchers look through different lenses than we do. They look through a lens of time, validity, ethics, measures, and resources, while patient partners look through a lens of experiences, vulnerability, expectations, language, culture, life experiences, circumstances, etc. Although very different, these seemingly opposite perspectives bring a richness to the overall view. So we're going to take a little look at the patient partner journey through this. As Donna mentioned, our project was focused on looking at case management model for people with multiple chronic illnesses. In the first year, the focus was on researching and selecting tools and designing the program. There were patient partners involved in the very beginning. So Donna and I, we entered the picture well after the primary setup, and I think we came in with different expectations than the initial patient partners. In hindsight, I don't think expectations were discussed. We got involved in the project at some point, and we were reviewing the questionnaire that was being administered to participants. In hindsight, I think that I struggled a bit from the very beginning. So one question that was in the questionnaire asked, overall, what I know about the treatment, including medications of my health conditions are. My option was a range of 0 to 8, from very little to a lot. Well, I have multiple chronic illnesses, and I wondered which one of my illnesses I should answer for. My diabetes would get an 8, my UC would get a 5, and my HS would get a 1. Another question was, I share in decisions made about my health condition with my doctor or healthcare professional. Again, the answer is completely different with each doctor that I have. So I tried to bring this up, but I wasn't being heard. We held a patient partners meeting, and as a group, we brought many issues that we had with the questionnaire to the surface. As a group, we brought this to the project team, and they explained to us that it was a validated questionnaire, and they had a schedule to meet. They were comfortable using it. So we continued to bring this issue up. We persisted, and eventually a senior researcher entered the picture and said, let's talk about this. This opened the door to a completely different pathway.
So at this point, having a senior PI recognize a leader recognize and acknowledge our concerns as legit was a game changer. This was key to unlocking the door to meaningful two-way conversations. A subcommittee of researchers and patient partners was formed to examine the patient partner concerns and explored together jointly options to address them. As a team, we began with setting a shared objective to gather meaningful and useful information from patients in a respectful manner that would, of course, also have research credibility. The simplest option, finding another questionnaire, wasn't available. So together we explored the question of how might we do it in a different manner. The result was to change the way we administered the questionnaire. With extensive research, we found established guidelines and adapted them to our project. So the workaround addressed everyone's checklist and ultimately, we believe, will improve the quality of the data. So the end of our journey on this particular step, looking back, co-problem solving was a longer route. It took more time, but it ultimately generated a better approach to gathering patient data. As patient partners, we think this approach to the questionnaire, administered by a person versus in the mail, may also enhance the patient connection with the project. In our situation, COVID was a help. While some activities were suspended, we had the gift of researchers' time to spend on this work. We hope time spent on activities like this will eventually become more of a standard practice. So Judy and I shared a snapshot into our patient partner experience of the process. There was much more work involved, and Judy will take you through the researcher's view.
So I can tell you that we have much more experience with our own perspective, but this is in the abstract, this is the journey that the researchers took. So their step one was recognition of the patient partner concerns, discussing these concerns and reframing the challenges. Detailing and sharing evidence of the validity of the questionnaires. Evaluating potential solutions. Searching literature for guidelines. Creating guidelines. And sharing and refining guidelines. So their 6 steps are in the abstract if you want to take a closer look. We can't speak to them as clearly as we can from our own perspective from the patient side, but the researcher journey is in here with key steps to trying to make this work. So here's something that we want you to take away from this talk. So adding patient partners to the mix is messy. But we have to work through this for richness of just our projects. So we need to communicate our expectations. We need to know what researchers expect of us, and we need to know what to expect from them. We need to listen to each other and accept contrasting views. We need to respect the different lenses that we bring to the table. I bring lived, real-life experiences that may not have been considered, while researchers bring the process, rules, and rigor of research. We have to learn to communicate so we both understand each other's view and not make it my view versus their view. Instead, accepting that we need to look closer and work together to find a common solution.
So recognizing and accepting that we have different views is step one. What we do with that and how we work with it is what comes next. And that's about co-problem solving. That approach brings a unique and generally more sustainable solution. So finally, as you've heard a number of times, we talked about discomfort. It's okay, accept and work with it. Just like families and good friends, relationships, like Judy said, are messy and sometimes downright awkward. Patient partnership is similar. There may be friction, and working through differences can be uncomfortable, yet we say get used to it. Great ideas are born in spaces of creative tension. Patient partners and researchers need to spend time to understand each other. Don't shy away from the conversations. That's what builds meaningful and impactful partnerships. And finally, we say to each of you, include patient partners early in your project. It makes a huge difference. Bringing us in midway handicaps us, and it's really a lost opportunity for the research itself. So thank you for listening today. Our champion PI, researcher Catherine Hudon, will be joining us in answering questions.